Right, welcome back to our clinic, and today I'm with Courtney, who's actually a regular patient of mine, and today we're going to talk through some of her concerns and how we can use a combination of toxin and filler treatments to get the best results. So welcome to the clinic, Courtney.
Thank you.
So in your own words, how are you doing and how can we help today?
Yeah, very well, thank you. My main concern is that I've lost the softness to my face, and I used to have a more heart-shaped face, and now it's becoming quite square, I think, where it's kind of sagging a bit. So I just wanted some fullness and lifting.
Okay, great. And how recently have you noticed those changes?
Well, probably since I turned 30.
Since you turned 30?
So over the last 5 years.
Okay, and so how old are you now?
I'll be turning 36.
Turning 36. So I've been treating you since your late 20s, is that about right? So previously with Courtney, we've done a variety of treatments, all of it very subtle and very natural. I think you may be able to notice here, under eyes have been treated. We usually use some botulinum toxin in the upper face. But let's go through Courtney's concern, and I'll try and show you what I see systematically in terms of what I think is possible today. I think the first thing to notice is I really like the shape of Courtney's face. I think she has very symmetrical, very attractive features, very, very good underlying bone structure. And you see that because of the really nice shape to her cheekbones, but also the lower third of Courtney's face is the most dominant third. And you see this because of the mandible, the structure of the mandible. The thing that draws my attention is also the width here, the bigonial width. And because of this beautiful structure, when Courtney's in her 20s, late 20s, the skin is tight around that structure, and it's a very aesthetic appearance. But what happens, the flip side to having this great structure and also these strong chewing muscles, is that with aging, when we start to get a little bit of laxity, it can easily start to look a little bit square, a little bit masculine. And so Courtney's concerned today about feeling like she's looking, I think it was in your words, you used to look like your mum and now you look like your dad, right?
Morphing.
That would be the reason why. And it's important to understand the difference in aging either side of this line of ligament. So laterally we have this passive sagging, and that means in combination with the strength of this chewing muscle, we're getting a lot of heaviness in the lower face. And so this is a challenging treatment because we have to manage the strength of this chewing muscle, but also the laxity of the skin with aging. So if you bite together for me and then relax and then bite, that's a good centimeter of muscle activity. This masseter muscle is hypertrophic, and it's something that we can reduce with toxin. We're going to see the result of that within the next 4 to 6 weeks. The risk is if we reduce that strength, we're also going to potentially worsen a little bit of the soft tissue laxity further down the lower face. And so this is why we need a combination of both the volumizing filler to lift backwards and then the toxin to reduce the muscle bulk. And in combination, that will be the best way to create a more beautiful, feminine V-shaped taper to the face, whilst also keeping the tissues lifted and projected backwards. A couple of other additional bonus treatments to enhance the femininity and preserve that in the face. The first one, if you look from the side profile, I just noticed here we've got a little bit of flattening of the frontal bone at a prominent brow, and a youthful feminine forehead would be more convex. And so I'm going to use filler to create that convexity in the upper face. The second thing is the lips. Because Courtney has such a beautiful frame in the lower face, she can afford to have fuller lips. And so a lip treatment in this case would be indicated and would be very suitable. So the treatment plan today is going to be focusing predominantly on the lower third with the mandibular angle, the lateral cheek with some volume and the lips, but we're also going to treat the forehead as well. Does that sound good? Okay, let's get to it. Sorry to interrupt this video. Hi, I'm Dr. Tristan Mehta, founder and CEO of Harley Academy, and I'm the one doing the injection that you're watching right now. I just want to take a moment to talk about our injectables diploma.
So Harley Academy is a higher education college for aesthetic medicine based out of the centre of London, UK. And over 3,000 medical professionals have gone through our academic programs to achieve a postgraduate diploma in aesthetics. They will get a title after their name, PG Dip Aesthetics. If you want to learn more about our programs, how you can gain your qualification and learn how to inject in a really structured, systematic and evidence-based way, then click on the details below and our team will be happy to have a conversation with you. Right, that's enough from me. Let's get back to the video. But if you are enjoying this and you want to see more content like this, please subscribe and click like.
So first of all, let's begin with toxin treatment. And I'm going to talk about how I inject the masseter muscle to avoid complications and also to get the best results. So the first thing is, if you bite together for me, I'm going to palpate for a very clear anterior border of the masseter muscle. Bite again. Wonderful. Okay, so this is the anterior border of the masseter. Okay, I'm also then going to follow the lower earlobe connecting to the corner of the mouth. Okay, so this gives me a nice corner, a nice quadrant that I'm going to be injecting in. If you relax and bite together, I find the most projected part of the masseter and relax, bite again. And then I'm also going to include, relax and bite again, a few other points, relax, bite again, where I feel we've got a lot of contraction. One more time, perfect. So this muscle now, and one more time, bite, it's also actually quite powerful up here. And in this case, I don't want to miss this area because I feel like it won't get the best result. The masseter has quite a large area of projection in this case. Relax and bite. Yeah. We're going to go a little higher otherwise. So let's talk about the risks of the masseter muscle. First of all, we're concerned about cosmetic risks in this case. With toxin, it's always about droops and asymmetry. And one of the muscles coming from the modiolus of the mouth laterally is the risorius muscle. The risorius muscle inserts into the modiolus, and we need to give ourselves a good 1 centimeter clearance from the anterior border of the masseter. So I don't inject more anterior than this line here, and this is giving me 1 centimeter clearance from the masseter. So this is how I'm going to reduce the risk of hitting the risorius. If I did hit the risorius, it would create a smile that would be quite asymmetrical. The second thing is we have the parotid glands, and obviously these injections are going deep down onto bone in the muscle. This masseter muscle lives on top of bone, and it actually has two depths. It has the deepest depth, then it has a deep tendon, and then it has the more superficial depth. And in order to get the best results for especially a masseter like this, is you want to treat both the deep and the superficial fibers. And I'll show you my injection technique to achieve that as I'm injecting. But in summary, we're staying inferior and posterior in the lower face. We're keeping away from the risorius muscle by giving ourselves a good centimeter away from the anterior border of the masseter. And we're injecting to try and target both the deep and the superficial muscle fibers. So this is 30 units of toxin. Normally I would use around 20 to 25, but in a stronger muscle like this, I'm going to increase the dose. I've identified 1, 2, 3, 4, 5, 6, 7 points, and I have 0.7 in my syringe. So each injection is 0.1 mils. And I want you to relax for me. We touch down onto bone. You have to go all the way down to there, and then I'm going to inject half of my product onto bone, and then I'm going to tail off the other half as I slowly remove the needle. And I'm going to repeat that across every point. So this one, I have to really push down like this to find the bone. I'm injecting half my volume, and then I'm tailing off as I come back. And we'll continue this approach all the way through these points where I've identified where the masseter muscle is strongest.
And what happens if you don't treat the superficial fibers adequately?
What I've seen in the past is that we end up with bunching up of the muscle. And so if part of the muscle is contracting and another part of the muscle is relaxed, we get strange contraction patterns, and they can create these cosmetic anomalies, which can often be resolved with additional toxin. Have you seen that before, Max?
Yeah, it's almost like a paradoxic bulging.
Yes.
But I've still, in patients who are bruxist, they've still had improvement of their symptoms because the muscle's still weaker. It's just cosmetically looks a bit strange.
How was that, Courtney?
Great.
Good. Great. So now we've treated with botulinum toxin. We're going to now create some initial layers of volume laterally to start to lift along the jawline. Turn this way. We won't notice the effect of this for 4 to 6 weeks, and so it's going to take some time. And when I bring Courtney back for the review, that will be the best time to see the effects of the toxin treatment. But it's not a problem now to start thinking about where I want my volume to be for contributing to this lateral projection that I want to achieve. And so if we look at the area where I want to treat, in this case, it's covered by this dotted line. And I'm really conscious that I don't want to lose this beautiful definition that we have on the cheekbone. So if required, I could put a little bit of definition along the zygomatic arch whilst I'm doing this treatment, so that I maintain this really beautiful cheekbone structure that Courtney naturally has. But the priority for me is to try and make sure I have good volume in this lateral posterior aspect of the midface. To do that, I'm going to use 1 ml of Heaviness contour per side to inject with a 22 gauge cannula. Little scratch coming in now. Good. So let's remind ourselves of how to inject this area. In young patients, when they haven't had any biostimulation, we can find that the cannula will find a really natural path. Okay, this is the kind of depth we want to be injecting in this area. We can tell that we haven't gone beneath the parotid masseteric fascia, so we're in the subcutaneous plane, and we're injecting in this continuous anterograde and retrograde direction. And I'm overlying this very strong chewing muscle because I'm anticipating that it will reduce in size over the next few weeks. But the majority of my volume is focused on where there are areas of concavity in this part of the midface, which is up here. This is where we have redistribution with aging. So we do have laxity of the skin, we do have redistribution of the subcutaneous fats, and so patients will end up becoming more hollow in this area with a little bit of laxity emerging along the lower face. This is the treatment that can help to reposition the tissues back to their more youthful position. To here, I'm just keeping a little bit of volume remaining to enhance the cheekbone here. And to do that, I'm just going to go over towards the zygomatic arch like this. And I'm just going to make sure we keep this lovely definition with just a few tiny deposits of filler in the subcutaneous depth whilst I'm treating this area. Perfect. Okay, so let's take a look at what this initial treatment has done. You can sit forward. Let's look into the camera for us. Okay, and just zoom out a little bit, please. Just looking straight ahead. Perfect. So I hope you can appreciate already that this side of the jawline is lifted compared to this side. If you look at the most pronounced part of the jawline, it's here. On this side, it's more like here. And the reason that's been possible is because even before we've reduced the size of the chewing muscle, the volume here is starting to lift and reposition the tissues. And so you can already see this more feminine shape emerging on this side. Also, just those few depositions along the zygomatic arch has pronounced the very natural shape to Courtney's cheekbones. So I've managed to enhance that and preserve that, even though I've added volume underneath. A lot of patients are concerned that if they have volume here, they will lose what they naturally have up here, but we can avoid that if we inject in the right way. Let's move on to the same on the other side.
I think for people getting started with this, even though it's, once you're in the right layer, it's relatively simple, it can feel unusual to push through those little septi
Yes.
underneath the skin.
That resistance makes people feel uncertain.
Yeah, definitely. But I mean, Courtney, you'll tell us, it's something that probably feels strange, but it's not painful as such.
It's not painful.
And it probably, someone who's looking on looks more uncomfortable than it actually is. And again, because this is lateral to that line of ligaments in an area that isn't mobile at all, you can use a slightly higher G' or firmer product than you initially think, considering it's a layer 2 treatment.
Yeah. Also, I find if you find this and you're pushing and you're struggling to get through this part of the tissue, if you just force it, it can be quite uncomfortable and you can often pop into the wrong plane. And so what I do is I have these little tiny micro movements that allow me to quickly navigate through obstructions, and that is more comfortable for the patient, and it also allows me to have less trauma when I'm injecting. Mm-hmm. So little micro movements I found with cannulas are quite effective.
And you're always using your other hand to provide that counter traction against your direction of movement.
So let me just show you how, again, I want to make sure I've got some cheekbone definition. I'm comfortable injecting in the subcutaneous depth here because we're not in an active part of the midface. This is a passive part of the midface. And so as I go along the cheekbone here, I can just make sure I've kept that definition along the zygomatic arch without having to make a new entry points. I can create this shape underneath the skin.
Yeah, nice. When you say passive, you mean in terms of movement?
Exactly, yeah. If you give us a really big smile, Courtney, this part of the face doesn't move on animation. And so we can inject just under the skin without worrying that the muscles are going to move this filler around when the patient smiles. Last injection now, just a little bit further up here. Okay, there you are. Thank you very much. So let's have a look at this together. Just back into the camera for us. So here I hope you can appreciate now we've treated both sides, starting to create that lift along the lower face. and we've still got very nice shape to the cheekbones. Next, we're going to move on to the lips, and this will start to see the final result when the patient comes back in a few weeks' time. So, just whilst the lips are numbing, I'm going to focus on doing the forehead treatments. And before I do that, I'm going to recap some of the important vascular anatomy for the forehead. And the forehead is what I would consider a high-risk treatment for filler injections. And the reason for that is because of the blood vessels. So if we remind ourselves about what the blood vessels are, we have 4 important points coming from the glabellar area. So we have our supraorbital vessels and supratrochlear vessels. Imagine these emerging from around the medial superior aspect of the orbit and the supraorbital foramen as well. And these vessels are tracking in an upward direction. And these vessels are branches of the internal carotid circulation. The supraorbital, supratrochlear, dorsal nasal artery all connect to the ophthalmic artery. That is part of the blood circulation that supplies the retina via the central retinal artery. And so simply by virtue of being so close to the artery that supplies the retina, this is why these vessels become part of our high-risk zone. The same would apply in the nose, for example, with our dorsal nasal artery. And so we have to think about our strategies to minimize the possible risk of intravascular injections. And forehead filler has this wonderful ability to have these dramatic, feminizing, usually, or rejuvenating levels of impact. But we have to always be mindful of the possible risks when we're doing these injections. And that's why we wouldn't recommend doing any forehead filler injections until someone had done, let's say, 2,000 fillers or more. The other relevant connection here is that our superficial temporal artery is an anastomosis with these vessels. So we have an artery coming from the external circulation, which is in this case the superficial temporal artery, can have a frontal branch like this, and this is where we have additional connections. And so it's all about understanding these vessels and the depth. In this case, we have the skin, we have the frontalis muscle, and we have the bone. We have a fat pad in front of the frontalis muscle, we have a fat pad behind the frontalis muscle, and we also have the fascia enveloping the frontalis muscle as well. And between all these layers, these vessels traverse at different depths. And so if we look in the lower third of the forehead, right along where this brow ridge is, so if you think about this brow ridge, very fortunately, we don't ever really tend to inject along this brow ridge because it's already projected. And so this bony projection isn't somewhere we'd want to treat. And that's very fortunate because these vessels, as they move up the forehead, they start off deep and then they become superficial. And about a third the way up, these vessels traverse from being deep to superficial. And that's important because that means that in this lower third of the forehead, around the brow ridge, we don't want to be injecting deep, but we are okay to be deep above that. And this gives us our injection plane for our cannula, where we're going to make an entry point just medial to the temporal crest like this. And our cannula will go behind frontalis muscle into the supraperiosteal plane. And from this plane, we can then create this convexity in the upper face. So that's our treatment strategy, but there's other things that we're going to do to enhance safety in this area. I'll clean up and we'll take a look. The best position to be in when we're assessing the forehead is from above, and that's because you can really start to identify exactly where you want the additional volume to be. And if I just mark on with my pencil the area that I see the volume deficit, it's it's this. And I've got a nice bit of projection above my line here. This is nicely projected. And then it dips down here and it continues like this. So anywhere between those lines, that's where I want my convexity of the forehead to be. I'm going to have to make an entry point from the side here, another entry point from the side here, and then usually always I have to make another entry point from the midline moving down into my injection plane, because the cannula struggles to actually meet in the middle and inject this central area. To make things comfortable and also to make the injection more effective, I'm using lidocaine, and this lidocaine helps to move the muscle away from the periosteum, and so I can quite generously inject lidocaine deep into this area, which has a lot of benefit for my treatment. Often if you're injecting a cannula along the periosteum, it can be quite scratchy for the patient, and so being able to create a bit more space whilst also making it numb is really desirable for forehead fillers. Okay, additionally, I'm just going to use some lidocaine at my entry point to make it as comfortable as possible. And the one entry point at the top here as well. So after that, we're ready for our forehead injection. So I'm using a medium to low G prime filler here, medium to low viscosity filler here, because I want to create something with longevity that has some projection, but I don't want it to create any specific shapes underneath the skin or from the deep plane of the forehead. And so I'm using Heaviness Ultra here. I mentioned there was another thing that I'm going to do to minimize vascular risk, and that's using a 22 gauge cannula. 22 gauge cannula is going to be the least likely to cause intravascular filler. So this entry point goes all the way down to the frontal bone. Normally with a cannula, a pilot needle, I would just go through the dermis, but because this is such a deep injection plane, I go down all the way to bone. And from here, I can pop behind frontalis muscle, and here I'm gliding on the supraperiosteal plane. And from this point, I can then have gentle, continuous pressure as I'm fanning my 22 gauge cannula into the forehead. And I'm looking from the side to ensure that I'm creating this convexity that I want to achieve. All the while, because I'm conscious of the vascular network here, I'm looking for blanching, I'm looking for skin discoloration, and I'm always asking if there's any discomfort, acute pain that the patient experiences. Everything okay?
All good.
All good. Okay, so 0.3 so far. I am nicely reaching the midline here. Sometimes you'll find that your cannula wants to move above the muscle, and it does that because the forehead is round, so it can sometimes be difficult to maintain that depth, and so we just have to be really mindful of injection depth whilst we're treating the forehead. This is one of those treatments that your patients don't ask for because it's not something that they notice or see, but it's something that as an injector you would notice and think it would really make a difference. And I'm hopeful I can show you today the kind of impact that this treatment can have. So we don't teach this as part of our courses at Harley Academy currently. You know, if someone goes through our diploma, then they're going to learn the development stage 1 and development stage 2 techniques. Within development stage 3, i.e. over 2,000 fillers, we're going to start thinking about things like the A-frame, the forehead, and the nose. Can I keep going? Mm-hmm. Pain out of 10?
0.
Oh, fantastic.
Very good.
I can hear it more than I can feel it.
Yes.
Best patient ever.
Now we got that on camera.
Proof.
It doesn't hurt.
Okay, so I always give this just a couple of seconds to make sure there's no cannulation of a vessel. Again, popping behind frontalis muscle, following the outline of where I've marked, where I want to treat. So I've got Dr. Max here with me. Max, should we talk through what treatments we want new injectors to learn and what kind of the journey would look like for people watching this video that might want to learn how to eventually start injecting more high-risk advanced zones?
Yeah. I mean, a lot of it has got to do with instrument handling and getting used to using a cannula, particularly in areas that are both technically less challenging but also safer, is one of the best places to start. So what you've already demonstrated in that preauricular area, that's a great place to start with learning how to use a cannula, because once you find your plane, you're going to be in that plane. Similarly with folds in layer 2, so nasolabial folds and labiomandibular folds, they're a great place to start as well. And then with the needle, the most obvious would be somewhere like the cheeks and the chin and the gonial angle, places that are not zero risk, but lower risk. When you're in that plane, you can feel it. And once you're feeling a lot more confident with the sort of feedback you're getting from those injections, then you can translate that fairly quickly into the development stage 2, into places like the temple.
And we talk a lot about risks, but for people watching that maybe are less familiar with risks, what would you say are risks that patients should meaningfully be concerned about? What are more routine things? What are things that we hear about but we don't see?
So, I mean, vascular compromise is exceedingly rare. I mean, I don't want to change things, but we treat roughly 4,000 patients a year, and we see maybe one every couple of years or so, thereabouts. So they are really very rare. And bear in mind, okay, we're a training academy, we're teaching safe injection techniques within that development stage 1 or 2. But all of our treatments are, or most of them anyway, are being done by people who are doing their first 10 to 20 injections. So we really do see very few. They are low risk. Similarly, with filler-associated blindness, exceedingly rare. We've been fortunate not to see any of that at all.
Thank you, Max. Right, Courtney, you did fantastically there. Can you describe that? Any pain?
No pain.
No pain, good. So that lidocaine really helped. And I'm going to take off the markings now, and then we're going to take a look at the forehead, and we can see how that has helped. So first thing is post-forehead filler treatment. The last thing we want to do is leave a thumbprint in the forehead. So whenever I'm doing any massaging, I'm using my gauze. I'm not using my fingers, unless there's a specific area that I just need to flatten slightly. So here, for example, I can just manipulate it ever so slightly. But otherwise, for me, it's really helped the aesthetic of the upper face. So let's have a look at that now from the top, first of all, which is, for me, I think a really nice shape. Now I'm going to ask you to sit forwards. I'm just going to sit forwards a bit like this. Thanks, Courtney. Back into the camera for me. If you look into that camera there, see on the ceiling? Yeah. Yeah, you got it. So this is what it looks like from the front. And if we turn all the way to the side now, I hope you can appreciate that roundedness that's now appearing in the upper face and all the way this side as well. So that's the effect of forehead filler. We lose that brow ridge, we lose that flattening, and it feminizes the upper face. And I think that one is a really nice example of that. So finishing touches now is the lips. Lips are nice and numb.
Very numb.
Last thing with the upper face, right? I just want to check for capillary refill. So you just do a few tests to make sure that the capillary refill is less than 3 seconds, less than 2 seconds in all parts of the upper face. So I'm happy with that. I'm happy with the perfusion to the forehead. So now let's focus on the lips. So these lips, for me, they're going to be what I would call the quite straightforward lips, okay? They have a nice shape to them already. They have good volume to them already. They're very natural, and we want to make sure that they stay very natural. And so the way I'm going to treat them today is just by focusing on the compartments of the lip. If you remember from previous episodes we've done, the lip is made up of 24 compartments. We have 12 compartments in the front, 12 compartments in the back. They're divided by the orbicularis oris muscle. And those compartments create these little cushions in the lip, these tubercles. And the best way, the nicest way to treat a lip is to preserve those tubercles whilst adding some nice volume in a systematic way. When I've got lips that I would consider relatively straightforward lips, I like to let the filler do the work. And what I mean by that is I can inject in a way that allows the filler to volumize these lip compartments without me having to move in and out through the lips multiple times, which can sometimes allow product to migrate. It can allow product to go into the wrong injection planes. It also increases risk, and it increases swelling and trauma. So if your patient wants to have a lip filler treatment, but they also want to make sure that they don't have a lot of swelling post-treatment if they're going out to see friends or something like that, then this is a suitable technique. This is our lip bolus technique with a needle. I'm using Reviness Ultra, and I'm going to start on this upper right quadrant here, and I'm facing the bevel of the needle forwards. We're just going to move into the layer 2 of the lip. Okay, we're not in the actual skin itself, we're just underneath, and we're just going to allow that gel to flow in an anterograde fashion to create some volume. And you can see this lip is now increasing in volume far beyond where I'm injecting as it flows into the correct compartments. So from that would be a 0.1 ml of product. And even from that, I hope you can see a very natural increase in volume to the lip. With this one, it's important that we just replicate it on each side so that we are keeping things even. This whole technique is all about being very slow and very careful. And the reason why potentially it's not as easy as it looks is because of depth control. I don't want my initial injection depth to go too deep behind muscle, because that's where we're going to find the majority of the large vessels in the lip. So even though I'm just injecting to a certain point in the lip, I'm confident I'm anterior to the orbicularis oris muscle. Pain level?
Nothing.
No pain.
Very nice.
Let's do the same in this lower lip now. So lips are often overcomplicated, and they do have a lot of moving parts. And so we have to be careful with lips. One of the ways we can make life easier for ourselves is by choosing a very simple technique and doing it well.
Is there a maximum amount you would put into each of these compartments in a single injection?
Yeah, that's a good question. I think depends on the lips, and also I'm sort of watching to see how much of a response I get. Yeah. These have all been 0.1 mil each time.
And I suppose because there's almost no trauma involved with this, or very minimal trauma, you don't get much swelling, so you can see as you go.
Yeah.
If you're doing lots and lots of little threads, then you
can't
get
monitor
swelling.
it. Yeah. So for me now, these lips are already looking really, really nice, and I've only injected 0.4 ml. We've got this nice little keyhole in the middle, which we're going to keep, because I think that looks really nice. So now all I'm going to do is just strategically add a bit more volume where I think the lips can benefit from it more, but I'm not going to go more than 0.5 mils in these lips. So we'll go a little bit in the midline here. Just blow a kiss. Show your teeth. And relax. And I'm just going to enhance these slightly laterally. Remember, in a feminine lip, it lives between the width of the nose, so we don't want to create too much volume laterally in the lip. Okay. Final thing I'm going to do is massage. Rolling to create that convexity in the lips, just like the forehead. And we can check for capillary refill. Lips all look well perfused. Big smile. Really big smile. I know it's numb. I know it's numb. And relax. So really natural lips here. Doesn't look like I've had any filler at all. So preserving that natural look. Let's take a look now. If you zoom out a little, we'll take a look at the whole face. Okay. So hopefully you can see here now the start of the rejuvenation treatment, and from the side you can see a little bit more of the vermilion of the lips, a bit more projection. You've got this convexity to the forehead, and we've started to lift in the lower face. In the next treatment sequence, we'll bring Courtney back. We'll see what the Botox has done to the chewing muscles, the masseter muscles, potentially add a little bit more support to the lateral cheek, and then we'll show you the final results. Tell us what you think.
I can't actually see. Yeah, great, very natural.
What do you notice the most?
For two contour.
I noticed that
Or nearly.
my face already looks like a different shape.
Mm-hmm. It's been lifted this way, right?
Yeah.
Lips.
And I suppose it still looks quite, not square, but I suppose that's going to drop, isn't it?
Yes. Yeah.
And my lips look very natural.
Mm-hmm.
just nice and full.
Do you notice anything in the forehead yourself?
I notice it looks there's a little bit of a line there.
Yeah, a little bit of irregularity is normal whilst it's settling. I think you might notice it. Maybe you notice that your eyebrows are positioned a little bit higher, but you may notice it from the side.
Yeah.
You may notice it from the side some more.
It looks great, thank you.
All right.
What we learnt in aesthetic medicine even 1 or 2 years ago is now outdated. Why? Because aesthetics is still a relatively new science, and the research underpinning our work, particularly our understanding of anatomy, has advanced significantly. Hello, I'm Dr. Tristan Mehta, founder and CEO of Harley Academy, and I want to introduce you to GEM, the Global Evidence Matrix. GEM is a dynamic, evidence-based framework that gives injectors a clear, consistent guide for safe, effective treatments, all grounded in science, not in corporate sales pitches. GEM combines clinical research, anatomical knowledge, and injector expertise, and it's always updated with the latest evidence. Think of GEM as your interactive map for facial aesthetics, guiding you through every step from technique to product choice. With GEM, you're not just injecting, you're working at the forefront of medical aesthetics. Join us in setting a new standard for safety and results. Okay, so we're back in clinic with Courtney. How has it been since we had that treatment?
4 weeks.
4 weeks. Perfect. So this one big video that they're watching, and so we're quickly transitioning to the after results of the Botox here. Plus we did some filler to create some support, and we also treated the forehead with filler. So in your own words, Courtney, what did you notice, and how was everything?
I noticed that my face looks a lot softer. I know I told you in the original appointment that I felt like I was getting quite chiseled like my dad. I'd gone from that soft like my mum to more structured like my dad, and I feel like I'm softer, and yeah, I just feel happy with what I look like.
I'd love to hear it. And have you definitely noticed things that slimmed down here a bit?
Yeah, this is definitely slimmer, and what I really love is the change with my forehead.
Okay.
Like when I look in the mirror, I can't really see what's changed, but I know that I look better.
Okay, amazing. So let's just zoom into here, please. And I'll tell you what I see at the 4-week follow-up. So first of all, immediately obvious to me is this shape that's now apparent across the side of the face. And so the width here, the bizygomatic width, is wider than the bigonial width. And that's really important for creating this beautiful feminine taper. And previously, the strength of this muscle is what created a bit more of this square appearance. And now we can see that it's tapering in like this. And that's because the toxin hits the muscle relaxes, and in the process, the muscle reduces in size. It will stay this way for 4 to 6 months, and then it will slowly come back. So this treatment is kind of twice a year if you want to sustain that. One of the nice side effects sometimes is it reduces the tension across the jaw. Have you noticed that at all? Or
Less headaches.
actually,
Come to think of it, yeah, don't get less headaches.
so
If I do bite down a lot.
but you notice here, if you relax and then bite, we still have some movement, okay? And it's important. I could go further. I could use even more toxin. The risk is that, first of all, Courtney has these very beautiful projected cheekbones, and it could look a little bit too tapered. The second is that this muscle does provide some structural support for the lower third. And we've already noticed potentially there's a little bit more laxity now because we've reduced this muscle, even though we've already put some filler back here. So my plan today is to add this final syringe of filler to kind of compensate for the reduction in muscle strength, and that will then really nicely finish off that mid and lower face treatments. The second thing is, which I'm extremely happy about, is the forehead. You turn all the way to the side. Courtney's got this very beautiful feminine forehead post-treatment, and previously, if you remember, there was some flattening, and this really just softens the upper third of the face, and it really supports the brows. It really supports everything across the face, really. And if I turn you back to the center, first of all, you can see the advantage here of using a really soft, cohesive product. There's no dimples. It looks very, very natural. This is exactly what a really good forehead filler result would look like. And there's no indication to do any additional treatment. So it was treated to the right volume. Now we have the opportunity to do some toxin, and I wouldn't have done toxin first and then filler second. Generally, we want to do filler treatments before we do Botox, because the filler can affect the position of the muscle, and because it's a mechanical gel, it's a structural gel, so it's always better to do filler first and then Botox second. So in this treatment, we're just going to show a 3-area Botox treatment. It's going to be a big frown, and we frown and raise up high as you can, very little movement there, and really big smile in the eyes. So we can treat that with Botox. We won't have a chance to review the after photo from the Botox, or maybe I'll get Courtney to show us a little video when she's home in a few weeks' time. But purposes of the treatment today, it's going to be just to do that treatment so you can see how I would do her Botox, but I'm going to finish off the mid-face with some filler as well. And last thing before I forget was we did treat the lips in a very, very subtle way, actually. And you'd never had any filler on the lips, or we did do it before?
Years ago.
We did it a long time ago. So anything about the lips that you barely...
Nice step. Husband did that, but he just thought it looked great.
Okay, well, it's really good to hear. So really happy with this result. Let's get on with the treatment, and then we'll show you the photos. Okay, so let's get started. I'm going to turn you this way. So we're just treating this area. We've got this little area of volume loss, and predominantly actually also to treat over the mandibular angle to try and create this traction over the jawline. Let's make an entry point there. And I'm just using Heaviness Ultra here, which is a medium G Chrome product. We're not trying to create too much projection here, given that we've already done. So I'm using Heaviness Ultra here because we've already used a syringe of filler in this area, so I don't want to add too much, but we're going to give 0.5 ml on each side. And Courtney's got this really nice skin quality, which means that you don't really see even the cannula or the gel under the skin. So there's very low risk of her having the visible tracts of filler under the skin. And I'm going to take my injection all the way over the mandibular ivy, which is now noticeably soft. If you bite together and relax, there's still some projection, but the muscle is softer and there's less bulk of muscle. So the toxin has done its job. Okay, perfect. I always like to do a little check. Let's just see before it's got me and look into the camera. So here we are again, see an additional lift. If you look at where the cheek, the corner of the jaw is here versus more, I would say, down here, we can start to see just that additional final touch of creating this beautiful taper to the lateral cheek. Head back. This way. Okay. Takes birds. If you find these little points of resistance, it's okay just to, you can pull back, you can relocate yourself. And I don't like to just push until it blanches. I feel like you sometimes bruise or be unnecessarily traumatic. So what I would do is just pull back and have these little micro adjustments that help me to very easily move through little fibrous divisions of the subcutaneous fat in this area. So again,
looks more uncomfortable, but actually by going through it, not just pressing and pushing against the lesion, it's far more comfortable.
Now, if Courtney was 10 or 15 years older, we may consider a biostimulator back here, because we would be thinking about enhancing the collagen in the tissue. But I can see that Courtney's got very good dermis strength, and so collagen is very strong, and I can feel that even when I'm moving through. And so she's not right now a candidate for collagenesis. I don't think she would benefit much at all from biostimulation. It's more just about volume replacement in this case. And a good example of that is just the toughness that I'm having to battle with a little bit as I move through the tissues here. So that's all I wanted to do to finish the filler treatment in Courtney. And here is our final results. Really happy with that. Okay, now let's continue with our plans for the toxin treatments. I'm going to mark up a routine 3-area toxin treatment. So the first thing is the glabella. So give me a big frown, please, and relax. So I'm marking on here my injection point for the procerus, medial corrugator, and then the tail of the corrugator, which I'm still treating in most cases, although these 3 injections are the 3 most important ones. The corrugator inserts into the skin laterally, so there can be some tugging. If you give me a really big frown, I want to make sure I do treat that tail in the dermis, so just underneath the dermis. Okay, so that would be my 5 points for the glabella. And then raise up as high as you can. You'll notice that Courtney doesn't have a lot of these forehead frontalis lines. There is some movement right at the top, but there is very little movement in the middle part of the forehead. This little line that's appearing here is this convergence line between the hairline depressors and the brow elevators, and that creates this very clear line here, which is sometimes called the C line. And that helps me to determine how I'm going to inject. Botox beneath this line will actually reduce the brows, and Botox above this line will pull the hairline upwards. And so a balance between the two, getting the depths right, will often get the best results. A more superficial injection is a weaker injection, and a deeper injection in the forehead is a stronger toxin effect. And the reason for that is that because the nerve that supplies the muscles comes from underneath. It's the facial nerve, and it's innervating from deep, and that means that deeper injections are going to have a more relaxing effect, and we can use that to our advantage when we're planning our toxin treatments. So raise up again, and relax. So Courtney doesn't have a frontal aponeurosis. There's just that many fascia here. It's just muscle, and you can see that by the contraction pattern. Turn this way, raise up again, high as you can, hopefully in there and there. This is typically how I would assess for movement. I'm always palpating for these temple crests. These crests become the lateral margin of our treatment. We don't have any muscle beyond these crests. I've got my central injection. Raise up again as high as you can. And then we can go here and here. As a bonus, I can treat deep above this line, which will elevate this compartment of the forehead. But I'm treating very superficially in these injections. And that generally follows with our plan, which is that we don't want to drop the brows. And so we are not really using a heavy dose in this central band of the forehead. We can be a bit more aggressive higher up. Any thoughts on that, Max? Are you happy with that as a plan?
It's just nice that you can tailor it. If you've got someone who doesn't respond that well to Botox on these very high doses, then often it's not just changing the doses, it's changing the depth of those injections. If you inject deeper, you might get more, but as you say, that relaxing result.
Really big smile around the eyes, please. Thank you. This way. Smile as much as you can. Okay, so it's similar pattern. Courtney's a perfect toxin candidate. She has a lot of this. She doesn't have a huge amount of movement, but you can see from her expression that there will be a very beautiful relaxing effect post-treatment. So turn this way and just relax for me. Just go 4 units in the procerus muscle. And same the medial corrugator. I just touch down onto bone and then slightly come off. This muscle is deep, and so I do need to go deep for this injection. And then for these little injections, I'm just going intraderm or just subderm, which may take a little longer to do the injection. Sometimes it will blanch. And that's how we would treat this very superficial aspects of the glabella treatment. Good. And then stay in very kind of just underneath the dermis. We're going to create these subdermal blebs. 2 units here. 2 units here. 2 units there. And then we'll just go a little deeper with 2 units in these 2 points. And that is our forehead completed. Turn this way. So now let's work through these final 3 points on each side. I like to do 4 units to lift the tail here. Then we can do a 2-unit dose and a 2-unit dose here. Down the side. And the same one here. 4 units. 2 units. 2 units. And that's the Botox treatment. Really nice to be able to do that after forehead filler, and I'd love for Courtney to send us a little photo and a video maybe in a few months, few weeks, if that's okay, just to see how this is looking, and then we can add this to the end of the video so you can see the results of that Botox treatment. Normal to have these little mosquito bites in the forehead post-treatment. They will be in the photos for the after photo, but there is the shot I'd like you to see, which is just hopefully really showing that beautiful curve to the forehead, the lift to the cheeks, and the new jawline as well. Happy? Okay. Thanks very much, Courtney.